Joined by another presenter here at ASH 2013 in New Orleans, and he is Gregory Hess, MD, from the University of Pennsylvania. Thanks for being with us, sir.
My pleasure.
What are you focused on there at the U of P?
I'm at the Institute for Health Economics and Policy, primarily as a senior fellow, and then I wear a few other hats. I also teach at the College of Medicine at Drexel, and then my full-time job is Director, Chief Medical Informatics at Symphony Health.
Okay. So you have an abstract on practice-based research platform. You created one. What exactly is this?
You know, in the past we would do prospective trials to gather clinical evidence, and now today we've realized that you can gather a lot of evidence more efficiently and in a complementary fashion by taking really the day-to-day information that we gather from our patients. Pooling that together, we get a much larger pool of information, and then we have a research platform.
What was the design and what did you find in this research you presented here?
The design was that we took the pharmacy claims for our patients, so the dispensed prescriptions, and then we also took the medical visits to our offices. And now today, as you know, there's electronic medical records, so we took that information in addition, and then we used a HIPAA-compliant process to create a synthetic ID that was able to link all of those records into really one central data set and pull many different patients that would be 5, 10 from smaller sites into one larger site.
You say a question you're asked a lot is, what's the difference between information from a practice-based network versus information from a clinical trial? How do you answer that?
That's a great question. Clinical trials are, of course, extremely important. They help us to prove prospectively the difference primarily between one treatment versus another. But to do that, we have to really have quite a few inclusion and exclusion criteria that really does not reflect what we see in real-world practice. In other words, when a patient comes in, I can't say, well, I can't treat you because you happen to be over 65 or under 20 or whatever the criteria may be. Whereas in a clinical trial, that will be the type of criteria often applied because you want to have one population very similar to another. In a practice-based network, it's really real world. So it's really any and all patients who come into the practice, in our case, in this case, diagnosed with myelofibrosis, and we gather that evidence. So it's very complementary to a clinical trial. It's not meant to replace it, but it's complementary in many ways, more generalizable than a clinical trial.
Technology is making such a difference in everything, especially for the patients now.
It is. We couldn't have done this before without the computing power that we have today and without really electronic records that allows us to bring those together very efficiently and very effectively.
Very good, sir. Thanks for joining us.
Thank you.
Dr. Gregory Hess joining us here at ASH 2013 from the University of Pennsylvania, Symphony Health.